Today we are going to discuss the lateral side of the skull, which is also called the Norma lateralis. So as you can see, this is the front of the skull, and we are going to discuss the lateral side of the skull. So the bones involved in the formation of lateral side of the skull are the frontal bone, the parietal bone, the temporal bone, the sphenoid bone, zygomatic bone, occipital bone, nasal bone, maxilla, and mandible, which has been removed from here. So these are the bones which are taking part in formation of the lateral side of the skull, or the Norma lateralis. Now we'll discuss the features one by one. This is the zygomatic arch. What is the zygomatic arch? It is the subcutaneous part which can be felt on the side of the face. The zygomatic arch is formed by the union of the temporal process of zygomatic bone and the zygomatic process of the temporal bone. So in anterior 2/3 we have the temporal process of the zygomatic bone here, and this is the zygomatico temporal suture, and the portion behind it is the zygomatic part of the temporal bone. So this is zygomatic arch. Zygomatic arch is present just above the area of the temporal fossa. There is a gap beneath it. The gap is deeper in the front and shallow behind. The anterior-most part of the upper border of zygomatic arch is called the jugal point. And the posterior part of the zygomatic arch divides into two roots. One is the anterior root, this one, and one is the posterior root, this one. The anterior root and the posterior root. On the lower border of the zygomatic arch, there is a tubercle called the articular tubercle, this one. This is the articular tubercle. And the posterior border end of the zygomatic arch continues behind as a suprameatal crest, this one. Now there is another structure that is called the suprameatal triangle. What is that? This is the external acoustic meatus. Now the posterior-superior border of the external acoustic meatus is forming the inferior boundary of the suprameatal triangle, or the Mach-Evans triangle. The upper border is formed by the suprameatal crest, and we draw a tangent from the posterior border of the external acoustic meatus. So a triangle is formed here like this. This is the upper border, this is the lower border, and this is the tangent. So this is a small triangle, also called the suprameatal triangle or the Mach-Evans triangle. Now this one is the external acoustic meatus. The anterior, superior, and partly the inferior border of the external acoustic meatus is formed by the temporal bone, and the posterior and superior part is formed by the mastoid part of the temporal bone. This one here is the mastoid process. Mastoid process is a projection. There is a fissure, the temporomastoid fissure, just anterior to the base of the mastoid process. This is the mastoid process. The mastoid process is a part of the temporal bone. This is the mastoid part of the temporal bone. The mastoid process articulates above with the parietal bone at the parieto-mastoid suture, and behind with the occipital bone at the occipito-mastoid suture. So this parieto-mastoid suture and this occipito-mastoid suture connects with the lambdoid suture, and at a point that is called the asterion. This is the point of the posterolateral fontanelle in babies, which closes by the 12th month of life. So this point is the asterion. And in the front we have an H-shaped suture that is between the four bones. Anteriorly we have the frontal bone, superiorly we have the parietal bone, Posteriorly we have the temporal bone, and inferiorly we have the sphenoid bone. So a suture, H-shaped suture between all these four bones is called the pterion. This is the point below which the middle meningeal artery and vein passes, and trauma to this area leads to extradural hematoma. The various attachments on the lateral side of the skull, or the Norma lateralis, are: the temporalis muscle is attached in the area of the temporal fossa. The temporal fascia is attached to the superior temporal line above till the upper border of the zygomatic arch below. The masseter muscle is attached to the inferior border of the zygomatic arch. This gap is filled with the temporalis muscle and the deep temporal vessels and the deep temporal nerves.